Well, days after Christmas, the CDC updated its quarantine guidance, recommending people isolate for 5 days instead of 10 after testing positive for COVID-19. That's regardless of your vaccination status. But there's still some confusion over the guidance for people who have been exposed to the virus. So tonight we are verifying, are the CDC's new guidelines for COVID-19 exposures the same for the unboosted and unvaccinated? Our sources are the CDC and Dr. William Schaffner, a professor of preventative medicine and health policy. The CDC says for anyone who's been exposed and have either been boosted or had a primary series of the Pfizer and Moderna vaccines in the last 6 months, or the primary series of Johnson & Johnson vaccines within 2 months, you should wear a mask around others for 10 days, test on day 5 if possible, and if you have symptoms, stay home until symptoms or a fever disappears. Now, if 6 months have passed since getting the Pfizer or Moderna shots, you're not boosted, or you got the Johnson & Johnson shot over 2 months ago, or you're not vaccinated, it's a little different. You should stay home for 5 days, then continue wearing a mask around others for 5 more days. If you can't quarantine, you must wear a mask for 10 days. You want to test on day 5 if you can, and if you have symptoms, stay home until symptoms or fever disappears. Dr. Schaffner says this means people who have been boosted have greater protection from the virus, so the guidance is more relaxed for people recently vaccinated or boosted. So we can verify, yes, if you have been exposed to COVID-19, CDC rules are the same if you were unvaccinated or you haven't gotten a booster shot. You can see more of this verified right now on 11alive.com.